And welcome back. Thank you for waiting and keeping up with us. Kabla nisonge tena nitawakumbusha. Always remember to invest with the right partner and with the right people. So, tukiwa holiday, don't waste your money. Don't waste your investment. If you have that money, just give it all. From the beginning to the end. Yani, they deal from the very first design. And as we move, they manage your project. And after they manage your project, they give you the best interior decor. So DreamWorks Investment Limited Company, they are the partner you need and they are trustable. How do you get to them? The contact is just below. Make a call. Now, back to the question. Nipuuze ama ni assume. Acha nione kama itaisha. Ama me and my partner. Pengine hatutaki kuiongelea, hatutaki kuiguza because of maybe some family, whatever. How bad could it get?
So thank you. Again, when we're interrogating how STI or sexually transmitted infection progression could, the repercussions it would have on the individual, may it be a boy or a man. Again, I had my interviewer ask or call on women. One, it would lead to infertility. Two, it could also lead to stillbirths or premature births. Yeah.
For the female side.
Yeah, it could lead to a woman who is already expectant giving birth to either prematurely or getting a stillbirth. Yeah, and again, when it progresses, it goes untreated for a long time, you could get blocked fallopian tubes. That means you cannot conceive, and you see that now becomes a long-term side effect. Yeah.
How about on the men's side?
Again, it would lead to, as we're saying, infertility for them. Yeah.
So hakuna any big problems. Okay, that is, infertility is a big problem, I mean, but kuna vitu kama maybe cancer related, maybe progression, maybe kuoza or something. You know, people when you speak of STIs, they think it's something so broad, so huge that it's incurable. Can you tell us, if left untreated, how far for a male?
For a male, we said like they say STIs like syphilis, when you're not able to treat it early enough in the primary and the secondary stage, and it gets to the tertiary stage, it will lead to even one going mad. Then there is that, and that applies for both genders. Again, there is we have one like chancroid. Chancroid is a sexually transmitted infection that eats up into the reproductive organs, that is the penis, and even the vagina. Inakula kabisa, inabakisha. Yani inaweza kula if you stay with it. Inakukula vidonda mingi. So unaona maybe your reproductive organ, once at the point of treating, unapata you have permanent maybe indentations. Hizo vidonda imekula, when they are healing unaachwa. Yani si vile ulizaliwa ikiwa normal. Sasa imeanza kupata vitu vingine.
Now, I have another maybe thought. Maybe kuna mtu anaketi hapo anajiuliza, how can open communication reduce the STIs between partners? Maybe I am having sex with multiple partners. The open communication, how do you think, how effective could it be?
Thank you. Again, we're saying when you get to have open and candid conversations with our sexual partners, we're able to address that problem in case we have an STI. And we know for effective STI treatment, there is what we call contact tracing. Contact tracing means if I am now sexually active, I've realized I have this problem, and it was after maybe a sexual activity that we had, maybe probably over the weekend. Now I'm getting discharges, I'm starting to develop ulcers or even warts. It is good to have a conversation with the person that we were having the sexual relations with or the acts with. So they are also brought on board, and when we seek treatment, the both of us or with all the sexual partners that we've had, initially we are able to treat that disease kabisa inaisha. But when we are not we are not having conversations with our sexual partners, that means we are hiding things from each other. It means when I'm treated and is not treated, and again we go ahead and engage in unprotected sexual activities, it means I'll be reinfected. So we are not able to treat the disease for it to be cleared. So we shall be finding ourselves in a cycle. The one partner seeks medical attention, they are treated. Then at the expense of the other who doesn't go for treatment, and because they are in a relationship, they want to live in their sexual life, they find themselves back having sexual intercourse, and the treated partner now gets reinfected, so the cycle continues. So it's good to have open conversations, especially in regard to the reproductive health and STI, so that we are able to in case we have any, it's treated and it's cleared and we are done with that. Yeah.
Do you think maybe education and creating awareness can reduce the rate at which the STIs zinapanda?
Yes, thank you. I agree that I'm in agreement that effective and sensitizations and advocacy, creating community engagement with the youth, especially on the social platforms. Again, we could have engagement at the youth in the church. We have during the football tournaments. Maybe we have a space where we are able to discuss matters STIs and how they correlate or the relationship between STIs and HIV, because one, they share a mode of transmission. And again, when we are discussing sex, we are not just tying ourselves to the vaginal and penis penetration. We are also discussing other modes of sexual activities like oral sex and also anal sex and the vaginal sex. So we are discussing heterosexual relationship. We're also incorporating the homosexual relationships and also bringing on board the bisexual, because we have men who will have sex through either the vagina and also the anus. And all the modes of having sex also create vulnerability, or they increase the risk. Inaongezea chance ya mtu ya kuambukizwa magonjwa ya zinaa, just in case they are not using condoms, they are not preventing themselves from contracting STIs. And again, we are saying ukipata ugonjwa wa zinaa wowote kwa sababu ya shida ambazo inakuja nayo, vidonda ukishapata inakuwa ni njia ya virusi vya HIV kupita kuingia kwa damu yako, kwa mwili yako, so inaongezea the risk ya kuambukizwa.
Speaking of the awareness, we understand in Embu County there might be ongoing awareness ama hizo education. So can you tell us more about it?
Yeah, so thank you. Again, we say that like whatever we are doing now on Uvoro TV, we are also trying to create more awareness on the need for people for men and boys to go and seek health medical services. That is in regard to their sexuality, so that they're able to clear the air on STIs and HIV. And also, we're also having other campaigns like we will have a walk on the specific day at Karaba, starting from Karaba Boys, walking all the way to Gategi, where the teams are also engaged in a tree planting exercise, where as they plant the trees, they're also having conversations around STIs and HIV and how it's affecting our men and boys. We're also having brochures and the banners that will have the same messaging, just to ensure that we are able to relate and reach to more people, that's men and boys as well as women and the community at large within Embu County. We're also having letters that are with a specific messaging that is tailor-made to reach to more congregations, especially in the church and also in the institutions along within Embu County. We're also having now, these among the many shows that we might be having with different stakeholders within the county, unpacking or discussing matters STI, HIV and health, the need for men to seek for help and boys as well. Yeah.
So, well, that is amazing.
Thank you.
I hope we will be part of it. Actually, we will be part of you because our main aim is to ensure everyone is healthy and they are safe at all costs. Now, what advice would you give to someone who's hesitant maybe to seek attention, medical attention, or reach out?
Again, I would say that we need to walk or live past our fears, because again, as we have had, the dangers or the disadvantages that come with us sitting down and also being silent on our problems, especially those affecting our reproductive health. We have seen that, again, we need to rise above our fears and face the fears by walking into a health facility and getting tested, screened for STIs and treated as well, screened for HIV and treated or managed as per the results that we are going to receive. Again, we say that if you receive an HIV negative result, the counselor works with the client or from a client-centered perspective, where the counselor works with the client to check in with them to ensure that they come up with a realistic risk reduction plan. Yani wanaongea apate ajitengeneze solution kwa shida yenye amepresent nayo kwa hospitali.
Now, I know the curious part is Is it free ama nitakuja nilete pesa yangu yote huko?
I would say we are aware of the shisha. So we are saying that when we seek services, we are registered in shisha, and also we seek services from the level 1, the level 1, 2, and 3s. The services are entirely free. It's only that now the hospital or the level 2s and 3s will invoice the shisha offices to pay for the services. So it's for us to go out there, walk into those level 2s and 3s, seek services, and to start with, we register, then we're able to seek services, and the services are entirely free. So it's just for the clients to man up and gather the courage, go out there, speak up, even from the community health volunteers. We know there are those people in the community, the key focal, the gatekeepers in the communities that can work with you to ensure that you are treated effectively. Yeah. So, and again, it's just a personal initiative for us to seek health services, especially for men and boys.
Wow.
Yeah.
That is very amazing. And I know now they are confident, and this is the face you'll meet in case you need any assistance. And this is the person you'll meet now. If they are interested in getting directly to you, how can they get to you?
I would say, again, as I started, I shared that I work at Embu Level 5s. So it is, we have the customer care desk, we have the community health volunteers, we have gatekeepers in the community that we work closely together, and that would direct you to the specific desk, so that to make sure you're also not taking so much time before you are attended to. So we have such persons on the ground that link you up. And we also work with a pool of peer educators and community health volunteers. So those will kuunganisha na the right person that will help you to address the problem or the need that you have in question. Yeah.
Thank you very much. And I will also add, so correct me if I may be wrong.
Yeah, okay.
You don't judge, but you listen and help. Is that true?
Thank you. Yeah, we as healthcare workers, we devalue ourselves to value our clients, and that way we are able to fit into their shoes and also get to empathize with them. We do not sympathize, we empathize. We walk the journey, the treatment journey with our clients, just to ensure that they get quality services and also their needs are addressed as per the specific need of the client.
Wow.
Yeah, to ensure that they remain healthy, because health is power.
Wow, I'm feeling so excited and amazed today, because I have learned a lot, and I want to reach out also. So if you don't have the problem, you can also reach out to the rest of the people now. Thank you for keeping up with us, and I am so glad you listened and you have learned. Again, we don't judge, we listen and help. So she has also added that health is power. Thank you very much. See you next time. And before I go, I will remind you again, invest in the right people. And that is DreamWorks Investment Limited Company. Don't be embarrassed of that space. And don't misuse your space as well, because they are here to ensure you get the best services and the best decoration. Not just that. You need architectural design. They are the people you make a contact to. Now, until next time, this is the Health Hub Show, and I'm your host, Nyambura Kama.